All my panelists are here, and we have a good crowd. So I'll start. I'll introduce myself. My name is Bradley Wellens. I'm the regional manager for Southeast Louisiana for the Louisiana Campaign for Tobacco-Free Living, and I'm very honored to be the moderator for this exciting Empowering People in Community series presentation on understanding Louisiana Quitline, enrollment, reach, and opportunities for the future. And one of the things that we try to do with these EPCS series is to educate the community about what we're doing in tobacco, and part of that is what TFL, LPHI can bring to this, and the things that are here. And one of the biggest things is what our monitoring, evaluation, and learning team have been doing with the Louisiana Quitline and our cessation team that you will meet have been doing. So with our series, the goal of the series, obviously, as the slide says, is to provide health, education, and resources to hope people, populations, and communities in Louisiana equitably. And that goes to all of our different goals that we do, both here at TFL and with LPHI. Next slide, please. With the learning objectives for this one, what we want to do is explain the Louisiana Quitline, the current state of enrollment and reach in the priority population. Second is to understand the importance of priority populations when discussing Quitline utilization and reach, and what population in the state should be strategically emphasized to achieve a national 1% smoker utilization benchmark. And then third is to understand what are the future opportunities, what are the goals, the potential strategies that we can use with the Louisiana Quitline with these priority populations, and how we can integrate this into our cessation programming. For the next slide. I introduced myself, I'm the moderator, but the three panelists, speakers, are going to be Tasleen Van Hatten, who is our Chief Program Officer here at Louisiana Public Institute, but she's the interim director for the Louisiana Campaign for Tobacco-Free Living. Second presenter would be Chriselle Stipe. She's our Senior Program Manager for Health Promotions, and Chriselle is the expert in cessation and cessation activities, and she basically oversees a lot of our Quitline activities. And then our third presenter is Charles Lehigh, who is our monitoring evaluation analyst, and he's the one who developed the data behind the reach and the you'll see with the presentation today. Next slide. I think we're Chriselle. You can take it from here. Thank you.
Yes, good afternoon. Thank you, Brad. Thank you everyone for being here. And talking about the Quitline, we want to focus on Louisiana Tobacco Quitline. And the Quitline here in this state is managed in collaboration with the Louisiana Department of Health Well Ahead program in conjunction with Tobacco-Free Living. So we have a dual partnership where we manage Quitline services. The LDH Well Ahead is the state arm, and TFL under Louisiana Public Health Institute is that nonprofit arm where we do a lot of outreach within communities. So we have a lot of partners that help us to manage and drive callers and enrollees into the Quitline. We have a large overall coalition called the Louisiana Tobacco Coalition, where we have local, regional, state, and national partners as a part of. And oh, I'm sorry, go back, Haley. As a work group, a part of that coalition, we have our cessation work group where we focus on barriers and challenges that we have in cessation across the state, which includes Quitline and then also in-person services. And so we have a collaboration of partners here That includes RVO Health, who is our Quitline vendor, who actually provides the coaching and counseling and services for Louisiana tobacco users. The Rapides Foundation, which is in Central Louisiana, that does in-person services. We also have LSU's Louisiana Tobacco Control Initiative that also does research and in-person services for their patients. Auctioner Health that does tobacco cessation, and also the State Office of Behavioral Health is also a collaborative partner regarding cessation services within Louisiana. Also, to improve our services and to make sure services are reaching communities, we are partnering with these partners that you see here. The AmeriHealth Caritas of Louisiana, we're working with them to help marketing specifically for their members. So, focusing on priority populations and in the Medicaid population and making sure services are reaching them. We created a workflow for their staff in order to refer folks to the Quitline. In addition to that, and what we have upcoming, we are working with Louisiana Cancer Prevention and Control Program, where we're including and incorporating the lung cancer screening along with Quitline services. So those who are enrolling into the Quitline and they are found to be eligible for lung cancer screenings, we're providing them with the resource and ultimately referring them to lung cancer screenings within their area within the state of Louisiana. In addition to that, we have our Southwest Louisiana AHEC, they service Southwest Louisiana, and we partner with them as far as driving those in the communities who need cessation services, as far as helping them to quit tobacco use and vaping. And also we train healthcare providers across the state to go ahead and refer patients who need that help to Quitline services. So what are quit lines and why do we use them for tobacco cessation? Quit lines have been found to be very effective and evidence-based way to provide interventions for people who need help to quit and provide a variety of services. Quit lines offer counseling, practical information on how to quit, referrals, and other cessation resources and self-help materials. Why does this matter? So Louisiana adult state rate at this point, 14% of adults within the state use tobacco. And that's compared to 11% of the national rate. So you can see that our rate within the state is higher than the national rate. Are quit lines effective? This has been a question that has been asked over the years. Quit lines are effective, and that's based on just studies that have been done by the CDC and as a part of the CDC's clinical practice guidelines, which is evidence-based. Quit lines are indeed effective. Quit lines provide counseling, and not only that, but in addition to counseling, we provide different types of nicotine replacement therapies as far as medications. And research always showed that the counseling that helps the behavior component, in addition to the medication that helps decrease withdrawal symptoms or help tobacco users control withdrawal while they're trying to quit, proved to be successful. And so quit lines actually offer both of those. Next slide. And so at this time, as I've completed giving you just information regarding the effectiveness of quit lines, I'm going to turn things over to Charles, who will provide us with more data and outcome and evaluation of our quit line within the state. Charles?
All right. Good afternoon, everyone. It's great to have you all here, and thank you to my fellow panelists for kicking this off. So why does Quitline Reach matter, and why are we really taking a new novel approach to assessing how we are looking at this engagement with this resource? Well, the biggest one is that Louisiana continues to exceed national averages when it comes to smoking. So about 14% of adults in Louisiana indicated that they smoke cigarettes, according to the most recent CDC Burfess survey. And the Quitline enrolled about 3,300 smokers in 2024. So that gives us about 0.67% Quitline reach. So not even 1%. Well, we understand that according to the literature out there, that about 1% of smokers engage with the Quitline nationally. So we're trying to bring us up to that national average, hoping that we can match that 1% of engagement that we're seeing nationally. And really what this difference, this third of a percent, is about 1,600 enrollees that we're not getting on an annual basis. And hopefully we can take some of these implications from the reach and use that to better guide outreach and to reach populations who are not enrolling in the Quitline at clips other populations see, or maybe guide better cessation efforts throughout the state to ensure more equitable access among these populations. So, I believe this is the same slide. We can go to the next one. Yes. Okay. So how do we measure reach? So as I mentioned, this is kind of a novel approach to assessing the reach of the Quitline. What we took the percent of Louisiana smokers, as I mentioned, 14% in 2023 and 2024. And we were able to break that down by demographics. And our reach rate is our number of enrollments divided by the number of estimated smokers in the state or, given population. And below here, we have an example for white adults in Louisiana from 2024. So we enrolled over 2,000 white adult smokers in the Quitline, and there are about 317,000 white adult smokers in the state of Louisiana. So that gives us about a 0.65% reach for that population. And that's how we got to the reach. So now we'll get into some of these populations. And so really the first thing I wanted to get at when assessing the reach is what populations are really lagging and what populations do we see a lot of, do we see really exceed this benchmark? So as you can see on the left of the graph, those individuals making less than $50,000 a year really do enroll in the Quitline at a really, really great clip of, over 1.5%. And in the most recent year, 2024, LGBTQ plus populations enrolled in the Quitline at over that 1% benchmark as well. But populations that we really see lag include specifically Black and African American adult males and all adult males, both failing to reach 0.5% in previous years, as well as in 2023, those without a high school diploma didn't reach that 0.5%, half of the benchmark. Some of these populations aren't even reaching half of what our goal is. So those are really the pain points for these populations. And hopefully by exploring the data further, we can really get at why. So again, where do we need to focus? So really the big takeaway from this graph is if you look all the way to the right, at the male population, like I said, less than 0.5%. That's about 1,500 enrollments. And earlier I mentioned we're missing about 1,600 on a rolling basis. So if we were able to have men enroll at a similar clip that women enroll in the Quitline, we would really start to bridge this gap overall. We get very, very close to 1%. But again, we also see, it's not perfect. There's some variance, but it really is driven by at least the big, how close do we get it to 1% is really driven by that lack of male enrollment. Next slide, please. And some trends within populations that we saw. And, we're dealing with less than 1%, so this might not look very eye-popping or eye-catching, but we do notice that those who have more educational attainment tend to enroll in the Quitline at a higher rate. But also we understand that those with a higher educational enrollment smoke at a lower rate. So Well, it's harder to get those without a high school diploma to enter the Quitline. We also understand they're smoking more than those who finish high school or go on to complete some amount of schooling after high school. So it's kind of a double-edged sword there. But one of the more striking trends that we found was among age. Really, it's about that cutoff of about 35 to 40. We start to see a jump in the 40s of how many people in age groups are starting to enroll in the Quitline. Now, this could be influenced by a variety of factors. We understand that when you're trying to get people to change their behaviors, um, some people might not be in that because of their age, they might not be ready to start to change behaviors. But we also understand, once you get to your 40s, your 50s and beyond, your doctors are more engaging with certain chronic conditions and behaviors that you might be doing. And this is also when smokers become eligible for lung cancer screening. So we understand that, when folks are going to get screened for a certain cancer, they might be more willing to, break habits for anything that might cause uh, them to go need screening in the first place. Next slide. So what progress did we make from 2023 to 2024? As you can see on the far right of this graph, we have the change. These previously highlighted populations that I've mentioned earlier in the slides all saw some level of growth in the Quitline reach from 23 to 24. Really, the biggest growth was among our LGBTQ enrollees, but also Black and African American males saw a growth of about, I think it was supposed to be about 0.03%, but it was maybe a typo. But again, we also see that those aged 25 to 34 saw about a 0.2% increase from 23 to 24. So again, we know that we're going in the right direction, and this is without us taking a look at this and starting to roll out, plans for increasing enrollment based on this data that we're seeing. Next slide, please. So one thing I did want to speak to very quickly, because I have a data background, as Brad mentioned earlier, I am the analyst for the monitoring, evaluation, and learning team. I always like to think about, well, even if the data says this, what do we have to think, keep in the back of our minds when we're really processing this data? So I think one of the biggest things is, because I mentioned this is really a more novel approach to assessing reach. There's really not great comparison groups from other states. So how do we compare in terms of this enrollment reach to other states? Isn't as easy to compare as how many calls do we receive, for example, compared to other states, or what percentage of those calls are smokers, and how does that compare? So the enrollment numbers aren't necessarily readily publicly facing in some states. So this again kind of restricts that state to state comparison. But going forward, we know that we have other tools to compare us, kind of be our yardstick against other states. So like I mentioned, call volume, how many folks call into the Quitline on an annual basis. Treatment reach, how many folks end up receiving nicotine replacement therapy or counseling as a result of enrolling in the Quitline, and how much are we spending as a state per smoker compared to other states. So again, these would help contextualize this new reach metric, and really start to help us guide where we need to focus our efforts. But again, I think despite the limitations, this really does help us get at what populations are we not getting to. And as we see, one of the big ones is men in Louisiana. Next slide, please. Thank you. So next, we're going to go over some examples we have from other states where they use programs to increase their Quitline's reach. So one of the first evidence-based strategies that we have is from Maryland. It's a tailored promotional campaign that they rolled out for behavioral health populations. They utilized TV advertisements, transit advertisements, some internet-based outreach. And because this was tailored for those facing behavioral health issues, they saw a 37% increase in overall calls and measurable increases within their behavioral health populations. Now, specifically for their program, they looked at what conditions individuals may or may not have, But for the scope of what we have at the Louisiana Quitline, we just see currently, or at least in 2024, only saw how many folks opted to enroll in that behavioral health support track. And that was about 40% of enrollees. And that is just a simple question of, do you have a behavioral health condition that you think would make it harder for you to quit smoking? And if they say yes, they get slotted into this enhanced track. But we also understand with tailored promotional campaigns is that they're just that, they're tailored. We can change this from behavioral health to something targeting men, to Black and African American men, to other populations that we see, young adults, maybe. So some things that we have to consider as a program is, what population would be the highest priority, and what channels would these tailored promote campaigns need to be implemented through to reach those populations that we are hoping to see higher reach in. The next strategy is culturally relevant messaging. So in Los Angeles County, they rolled out a menthol awareness campaign with visuals that really kind of like emulated the old-timey tobacco industry tactics, these attractive people and bold collars and looking like they were having a lot of fun, but it was all based around getting folks to kick menthol cigarette smoking. So taking these motifs from this, you know, troubling campaign in the past and really getting at it to help fix our problems today. And one of the things they saw from this was they almost doubled calls from African American smokers and saw a similar increase in Latino smoker calls from Latino smokers over the course of a 1 month campaign. Um, and again, this is relevant for us because, as previously mentioned, Black and African American males specifically are less than 0.5%, and Black and African American adults too also fall short of that 1% benchmark. So it's really only about, 30% of what it could be at the benchmark is what we're seeing from this population. And this is just another, potential tool in our toolkit to help increase quitline reach in the state. So again, are our materials really resonating with these priority populations? If they're not, how can we change them? And if we do change them, would community input and testing really help improve the effectiveness? The idea is that, any community input is good input, but it's always a consideration to take when rolling out new campaigns. Next slide, please. Thank you. And lastly, we have community-based promotion content as our final strategy. So an article in the North American Quitline Consortium put out, they said that about 54% of callers to the Asian Smokers Quitlines heard about the service through culturally relevant media. But in this specific case, it was print media, newspapers. So this really kind of emphasizes the importance of meeting people in the spaces that they're already used to being in. So if a population still reads the paper at a higher clip than others, then that's where you should get to them. If they're using public transit more than others, then that's a good mode to get to them by putting it in those spaces. Again, this is relevant for us because a lot of TFL's regional managers they're already in these communities. They understand where these populations exist and how to reach them better than maybe I do here sitting in my office, for example. And additionally, we have to think too, these trusted messengers and these, channels at which we can get to populations really vary by where you are and who you're trying to get at. So that's, again, a consideration to take into the future. So yeah, we have to think about what messengers do we have access to and which ones do we not, and what support and tools could we help get to these messengers to help them help us expand quitline reach, as well as, can we track referral sources? Are these campaigns utilizing these new channels really getting people to enroll in the quitline? I mean, that's something we collect data on, so we could always see that reflected in the future. And I will pass it on to Taslim.
Well, thanks, Charles and Chriselle. I think you've laid the foundation really well for us to just start thinking about where are there opportunities? And I say where are there opportunities for all of us, knowing that so many of the partners on the call across the state are somehow connected to the Quitline, right? They're either referring folks to it, they're intimately involved in it, they're like TFL promoting mass communication and mass media resources to drive the different populations that they're working with to the Quitline and additional cessation services. And so the goal of today is both to present a little bit of the overview of the data that Charles provided, and then really to get your wheels turning around what are the opportunities. And so as we move into the next slide, I want folks to think about that 1% as really the baseline, right? It's our minimum. We want Louisiana to, at a minimum, be at the place where the national average is, that 1% engagement in Quitline use. We're never content to sit at 50th or at the bare minimum. And so we know our long-term goals are, of course, to continue to increase that rate. But as we think about the now, it is to at least meet what we know is more of a national baseline. And as Charles spoke about, there's a couple of different ways that TFL engages in this work, and then maybe some food for thought for folks on the line as to how they might continue their work in general. So some of our work sits within the larger mass communications space, marketing and communications. Obviously, our community engagement and outreach work, and where we can leverage increased support for populations that we know have a higher rate of opting in to the Quitline. And then, of course, wanting to think about special populations and where there is the highest priority. So maybe let's skip to the next slide, and I can jump into how are we really thinking about next steps for our Quitline engagement and the work in which we're doing to increase cessation. So here it's probably really important to just talk about, from the TFL perspective, we think about need and opportunity, which are both very closely related, but two very distinct concepts simultaneously, right? So need is really where we're thinking about those priority populations, where the gaps are the largest. Need refers to, like I said, a disparity, a gap, a problem, or some sort of deficiency that needs to be addressed to prevent future harm. And it's really often, and most often, rooted in urgency and unaddressed necessity. So that could be a lack of previous access or inequitable access to something. And then simultaneously, we think about where there's a little bit of opportunity and where the intersection of those are. So need is like the gap, and then opportunity is actually referring to the potential to create added value, which I'll talk a little bit more about in a minute, right? It's improvement or growth in a group that might already be heavily engaged by responding to their specific situational needs, so that we know we can drive greater engagement. Right. And then you've heard a little bit more about some of the examples of what has worked in other states that we continue to source in our work to really understand how we are shaping our mass media, as well as thinking about future engagements. And then lastly, we're really heavily focused on our work on how we're tracking what we're doing. It's fantastic today to have a little bit more of the data from Charles to understand both where we're getting to our 0.67% engagement rate, but also really starting to understand what are the numbers that we need to be tracking across populations, ages, groups, etc., so that we can really start thinking about where to target our efforts next. Can we go to the next slide? Right. So as I said, as TFL starts to think about the difference between need, right, that referring to the gap, and opportunity, which is growth by responding to situational engagement, the priority continues to be the way in which we're engaging youth, African Americans, and African American Black men, and then men overall, knowing that some of the greatest disparities in Quitline engagement and access, as well as some of the greatest need within our numbers, sit within those priority populations. We also know that once engaged in the Quitline, as Chriselle said earlier, it's a deeply cost-effective methodology for engagement and has one of the higher cessation success success rates, particularly when combined with counseling and other opportunities with free NRTs or additional enhancements. And then to what Charles discussed earlier, when we start thinking about opportunity, we're really thinking about the ways in which we can start leveraging populations that we know are already engaging with the Quitline, and therefore really doubling down on the potential to grow through responding to what their specific needs are. So Charles talked about individuals over the age of 40 that start to increase their call-ins to the Quitlines or engagement with the Quitline, right? And what we see is there's actually really distinct patterns for individuals over the age of 40 with Quitline engagement. And often that is driven by healthcare concerns and then a desire to really reverse tobacco-related damage as folks enter into both an era of their life where they are engaging in cancer screening, but also more aware and starting to receive more diagnoses around chronic disease that often have strong associations. So what we see is that while folks 50 and above are those that are most likely to utilize the Quitline. We also see that by the age of 40, we're starting to see an increased level of engagement within that. And we really want to make sure that we are capitalizing on that moment of motivation while folks are starting to think about emerging health problems such as chronic disease, while also oftentimes having at least one preventative screening around cancer. And of the 16 cancers that have a strong association with tobacco use, both men and women are screened after the age of 40 for at least one of those cancers pretty generally. And so have at least one clinical opportunity during the year to be reminded about education in the cancer prevention space and a referral. We're also really trying to think about, no, can you go back one slide? Thank you. Right. So as Charles said, we're also really trying to think about and working with and encouraging partners to start think about the measurement tools for impact tracking. I'm probably thrilled to report that at least half the folks on the line are somehow associated and affiliated with referring individuals to the Quitline in Louisiana, and really starting to work with our partners on understanding both how TFL refers individuals to the Quitline and what is most impactful, whether that is through mass media engagements or community engagement work, as well as working with our partners to really understand across all of the different partners in the Louisiana Tobacco Coalition what is most effective in driving different communities to Quitline utilization. Simultaneously, I'd be remiss if I didn't talk about this last piece, which is really meeting the moment. We're in an era where as of September 30th, our largest national initiative to help support states in driving individuals to state level quit lines, which is TIPS, or as many of you know, the Tips for Former Smokers campaign, which is one of our largest evidence-based mass media campaigns across the United States, funded by CDC, is moving into a period where it is no longer funded. Why that's critically important for us to understand, both in terms of TFL's strategic direction, but likely many of the partners on the line here, is while we might sit at that 0.67 now, about 30 to 50% of all of our referrals to the tobacco quit line were through the national line and through those larger TIPS campaigns. And so we're going to see some marketed potential drops in our engagement rates unless we really leverage some of our state-based work to try to make sure that folks are able to gain the awareness and the information. So it's really knowing that we're going to have to respond to the national dearth of mass media and engagement at the local level and the ways in which we can partner to do so. Next slide. So I'm going to turn it over to Chriselle to talk a little bit more about what some of the Quitline resources are before we have a chance to really hear from many of you on where potentially your strategic direction, ideas, and additional questions might live. Chriselle?
Thank you, Tasleen. Louisiana Quitline resources. So we know that initially when Quitlines first started, that most of participation and enrollment was via telephone, hence the name Quitline. Over time, with new technologies and new ways of people receiving information and services, of course, we've had to be flexible. We've had to adapt and pivot our state's Quitline. And we provide Quitline services, which includes a number of different things. It's basically integrated telephone. We say integrated because the telephone counseling includes web-based services, also texting services, and chat. And this is all to support Louisiana residents who use tobacco and nicotine, all types of tobacco. I just want to stress that. Not only the combustible cigarette or tobacco that you light up, but also smokeless tobacco, and then vaping. So as these new products are coming about, we have trained tobacco treatment specialists who provide the coaching and counseling for those who need it. And so they are consistently trained in new products that come out. So the question recently has been asked, do they help people quit vaping? And yes, they do, along with other tobacco products. So basically, the Louisiana Campaign for Tobacco-Free Living, in collaboration with the Department of Health's Tobacco Control Program, which is called Well Hill, Louisiana. We've been managing this Quitline service, and people can enroll multiple ways to the Louisiana Tobacco Quitline via phone, web, with our quitwithusla.org website, and they can also, to get started, text the word ready to 39141. Quit With Us Louisiana is a joint collaboration between the two organizations. And so that's basically what our Quitline services are called. Quit With Us Louisiana. It's the website name. So in this, we share our efforts in informing and educating communities and also increasing access to those across the state who may not know about the service. We've been providing the service for years now. People still may not know that this service is available to them free of charge. So we're constantly working with community partners, regional partners, to get the word out to communities and connect them to services. So we do provide tailored services. As you heard today, the focus really needs to be on those priority populations who still use tobacco. How we're doing that within our Quitline is that we have tailored services. We have a standard track for people to go through, but we also have tailored tracks. Behavioral health is a tailored track. Pregnant and postpartum women go through a tailored track. Also, we have tailored services for youth. And we also have added in previous years a menthol enhancement. So those who use menthol cigarettes, we know that menthol has a stronghold and it's very difficult to quit. And so services are tailored to those populations who are using menthol cigarettes. Also, another enhancement is a culturally enhanced service for African Americans using the CDC's Pathways to Freedom, in addition to their counseling services to tailor helping them to quit. In addition to that, how we're connecting communities is promotional campaigns. So we looked at the data. You've seen the data presented by Charles today, and also what Taz talking about what's next. How do we reach these populations? How do we tailor our reach to them? So we provide mass media. And so how we can do that is definitely tailoring that media. And like Charles said, how we reach specific communities, meet them where they are. We also have a large community outreach where we have regional managers across the state that are in communities, working with local community partners and activities and events in those areas to do more tailored outreach in those communities. Quitlines have a greater reach to those in remote areas, in rural areas, and those who have limited mobility. Um, we collaborate with many stakeholders and community partners, and in that we know Quitline services is a great way for folks to quit. In addition, we're working with community partners with their inpatient services too. So when someone actually enrolls into the Quitline and they're getting Quitline services and they're looking for something in addition to what they're receiving through the Quitline. So we do provide Quitline with Louisiana resources across the state, and we may link someone who's going through Quitline services to an in-person service to enhance their chances of being successful in quitting. Next, we have our takeaway and resources. For more information about what we spoke on today and resources within the state, you can go to tobaccofreeliving.org is our website. Also, our partner's website, Well Ahead Louisiana. You can receive information regarding unfiltered facts, which is more information and education on vaping. Also, a school vape-free toolkit that we created in collaboration with the state. You can access that there. Our Quitline information is here, and also our Live Vape-Free program, which our Quitline service provides a program specifically for teens and young adults addressing vaping, and it's completely text-based and very effective for youth. Young adults are provided nicotine replacement therapy through Live Vape Free, and teens are provided only the counseling component of it. And we also, in addition to that, how we're addressing the youth vaping issue within the state. So we have our Next Era programs where we have a youth advisory board who sits on a board that actually provides advice to us as public health professionals who are trying to address this issue. We're receiving feedback and guidance and insight from youth who are represented across the state. This information will be provided to you all, copies of the PowerPoint. So if anyone has any questions regarding our resources, you can access that information here, or you can contact any one of us presenting today. I'll turn things back over to Brad. Here you see our works cited. So basically the information that's been presented today. Here are our sources. And take it over, Brad.
Yeah, thank you. Yeah, we'll right, exactly. Thanks for advancing the slide there. We do have a couple of questions, and I think Chriselle, the first question probably is much more directed to you, and it says, how long have we, and I assume they mean to Quitline, worked with AmeriHealth Caritas Louisiana, and do we have any outcome data showing the effectiveness of this partnership?
So we've worked with AmeriHealth for about 3 years now. We are definitely having lessons learned here where we're working with the MCO. We're providing them with marketing content for them to actually promote services to their members via social media. We work in the community with their community wellness team and their mobile unit as far as providing information and promoting Quitline services. We've also worked with the case managers and quality improvement, where we've provided them with a workflow on how to actually refer those who are eligible for Quitline services directly to the Quitline through an online portal. So we are consistently working with the AmeriHealth. We are working on driving up those numbers. We know it's difficult uh, getting folks to actually utilize Quitline services, that population. So we have to be creative in the way that we're reaching them. We're constantly working with AmeriHealth, and we continue to work with them. So we're improving the things that we're doing with AmeriHealth. And we're definitely open to work with other MCOs also, and focusing on their specific client population and getting them services.
Great. Thank you, Krisha. The next question is from Mrs. Robert, and she's asking, is there outreach or current future partnership with high schools and school systems to promote the program and influence students or adolescents to benefit from the Quitline? And she says, specifically in areas where underage tobacco and smoking rates are high. And I know, Chriselle, we talked about the Youth Advisory Board, but maybe this is a great point for you to kind of emphasize that and talk about a little bit more of our youth program, since you oversee those as well.
Yes. Thanks for that question. So we have a number of strategies that we use to address the youth issue. It's not only vaping, but it's also smokeless tobacco, such as those nicotine pouches that are very popular right now. We have our Next Era programming where we have our Youth Advisory Board that's helping us to advise us on addressing the youth. We also have Next Era groups where we're providing advocacy, empowering you to be advocates within their communities. One thing that we're doing that we started 3 years ago was provide a vape town hall in certain regions across the state. And it was to address the high prevalence of vaping within Louisiana, and we continue to do that today. The purpose of the town hall is to gather those who advocate for youth, school administrators, parents, coaches, teachers, caseworkers, nurses, get everyone's input, the community's input, and talking about the issue that's happening within their areas. We would have a panel of experts, those within the communities that actually work with youth and are seeing things that happen. So we've provided brief education on vaping. We've had panelists talk about the approach and what's being available in that community to help youth. And we also received community input, and that's a large purpose of why we do the Vape Town Hall, is to receive community input from them to let us know, to help guide us on the next steps that we need to take to address vaping within that specific area. Because we know that Louisiana is different from the state. So we want to address things culturally within this area, but also within Louisiana. You have certain things that certain communities see compared to other communities see other things. And so just pulling and finding out what's needed in those communities. And if those communities need anything from us, we're able to provide them with technical assistance and training and addressing the vape issue. We have regional managers across the state who get requests from local school boards and local schools for someone to come in and do education. And so we provide that to youth. We provide that to teachers and administrators and also parents. And it gives us the opportunity to go in and do technical assistance and training on how schools should address based on best practices on how to address vaping within their schools, whether it's changing school policy ultimately or providing an alternative to suspension when students are identified with vape products, rather than suspending them, actually putting them through some positive education and reinforcement. So those are a list of a few things that we work on regarding youth. Everything that we do is based on best practices in addressing vaping within youth. But yes, we are working with schools and school systems. We partner with the state and with the school vape toolkit. We worked with the Department of Education in distributing that information.
Yeah, thank you for that, Chriselle, and I appreciate you mentioning the Bacon Town Hall because that's a big part of what we do, and we've been expanding it out into all of our regions, and then working with the schools, and it can go from like I've been in classrooms all the way up to doing presentations like the Bacon Town Hall. So it's tailored to what the community needs and wants at that time. So really
Yeah.
Appreciate that. Have another question here, and
Yeah.
it's a good question. I
Yeah.
hadn't thought about this.
Sorry,
And
Brad.
Yeah.
Tesley.
go
Brad,
ahead.
can
I'm
I
sorry.
no, that's okay. Can I add like two high level pieces? Because I think they're incredibly important for resources. So I think we continue within TFL. Chriselle described in detail all of our community engagement tools and tactics with schools. And it's also really important to know that the greatest amount of engagement that we also push continues to be in that mass media and information space, which is so incredibly critical to young people, both around commercial combustible tobacco use and vaping, both of which have actually incredibly high rates in Louisiana and both higher than the national average with young people. So we don't want to lose that. We're continuing to really push both um, all of the educational settings and youth development settings to address vaping as a new and emerging issue while simultaneously not forgetting that we continue to have those high commercial combustible rates. What's really the last two things, which are both the old school but most important pieces, is really the work that we do around providing signage for folks. And that's signage for both schools, school districts, and different community spaces so that regardless of where young people are engaging, they're able to see signs on the wall for where they can call, text, or engage with those cessation services over time. So that's also, I want to bring that up because it's also the offer over time with partners on the line if they are seeking additional resources. And TFL has done that in innovative ways through bathroom decal pilots with vaping in young people, which our next EPCS will be focusing on, as well as traditional signage in schools. So back to you, Brad.
Yeah, thank you, Kathleen. No, it's actually my next question was sort of lead into, would you like to comment on, some of those things and talk about how to connect what Chriselle's talking about and what we're seeing with some of the things that Charles pointed out in there's different strategies that are used in the state and what are some of the data speaking to you where the opportunities are. Charles says he pointed out 1,500 men, and like how do we increase that rate, particularly with the loss of the CDC tips funding. Is there something here that where do you see those areas of opportunity if there's a takeaway from that you want people to leave here with that we'd like to focus on? Either Kathleen or Charles? And the other. Go ahead,
Great. I'm
guys.
giving Charles an opportunity, and if not, to jump in. So, of course, from the TFL perspective as a program of the LCRC and LPHI, really thinking through what are the most, as I said, that intersection of both need with the highest priority populations and the opportunity, meaning the ability to capitalize and ensure that we're building on folks that are already much more naturally progressing into what I would call in an engagement era in their life. And so as we think about that, being able to leverage the Quitlines both for cost efficacy and an evidence-based intervention is really critical. Now, one of the easiest ways, but also the way that TFL is most most committed to doing that is through our mass media engagement work across the state. Chriselle talked about how we do that in many different community settings and with many different community partners, and all the many partners across the state that come together to form coalitions to drive individuals in every single community. But simultaneously really stepping into the ability of mass media to engage with priority populations through really critical segmented mass marketing and mass media engagement. And so we'll continue to do that work with young people. We'll continue to do that as we think about the ways in which to engage more men into the Quitline services, African American men, and then start to really think about how we can make sure that our messaging is engaging folks based on age or socioeconomic status or education to ensure that we're capitalizing on opportunity as well.
Charles, did you have anything you want to add?
Yeah, sorry, I was gathering my thoughts for a response. I think, at least as someone who's very data driven and appreciates that aspect of this line of work, I think one of my biggest wishes with this is, once we get to that 1%, you hope that it's even across the board for all of these populations. But I really want to get at, the populations that see the highest burden of disease from smoking related illnesses, whether that's lung cancer or COPD or bronchitises. We know that if you're in the quit line, you're more likely to quit than if you were to do cold turkey. And it might not be the first time you go through the process, but it'll happen. We know that. So I would personally like to really make sure that those populations that see that really high burden of disease as opposed to that, baseline average, I'd like to see them come up to 1% sooner rather than later.
Well, thank you, Charles. I appreciate that. That really kind of, ties it all together. We have, 2 minutes left here. I think I just wanted to say thank you to the panelists for just some wonderful discussions and bringing out some things about the Quitline that a lot of us did not know, and making the connection from the CDC down the national level down to what we're seeing in our communities and how the Quitline can be used and hopefully expanded, hopefully continue to be used, hopefully to use it as we go forward. And so, thank everyone for being here. Thank you to our panelists. I have some comments here saying thank you to all of y'all for a great presentation. And to remind everyone that we will be sending out our resources, we'll be sending out our data, we'll be sending out the PowerPoint, and most importantly, we'll be sending out an evaluation, just let us know how we did and how this was. Our next opportunity, I think, is going to be March the 26th. And to follow up on something that Tazleen said, where she talked about having signage. This is our EPCS will be about our bathroom signage programs, and then on March the 26th. So, all right. Well, thank you all very much for joining us, and that'll do it for today. But I really appreciate this. Such a wonderful presentation, and cannot say any highly more about everything that y'all have contributed. Thank you.
Thank you.
Thank you.
Anyone?
Thanks, guys. Oops.